Hello, my curious cats, and welcome back to another episode of the Say Psychology Podcast, the podcast for all the info on psychology's most questionable history. I'm your host, Leslie Lopez, PhD student and psychology nerd. Okay, quick check-in. I know these last two episodes have been a lot more deep and grim than any of our other past episodes, so I just want to make sure we're all doing okay. I mean, personally, I know when I'm doing all the research for all these episodes, it can get pretty deep for me, but also I found that that's just kind of the beauty of psychology. I mean, I have a bachelor's in psychology, a master's in forensic psychology. Heck, I'm getting a PhD in cognitive psychology, okay? So I found that just psychology, when it comes to psychology, the beauty is in the research. Yes, it can get pretty deep, and yes, it can get pretty sad and just grim through it all. But that's just the beauty of the human mind, and just trying to understand every itsy bitsy part of the human mind can just be so perplexing. And that's just how it is. That's just how psychology is. Wow, I cannot talk today, can I? So with that, let's jump into today's episode. Today, we are taking a deep dive into insulin coma therapy, a procedure introduced in the early 1900s as a psychiatric treatment to treat mental disorders that quickly turned dangerous. No surprise there. So, if you're a little bit insane in the membrane like me, get cozy tozy, and let's jump into it. Alright, you guys, so as we can all see, I'm still not back in my usual setup. My trip to El Salvador is hopefully going to be coming to an end soon. Not that I want to leave or anything, but I am starting to get a bit homesick. So, like I said, not that I want to leave, but I do kind of want to get back into the normal routine of things. But for now, we continue to improvise, okay? So, what exactly is insulin coma therapy? Insulin coma therapy, also known as ICT, was a psychiatric treatment that involved repeatedly injecting patients with insulin to induce hypoglycemia and a coma as a way to treat certain mental disorders. Essentially, patients were given increased doses of insulin over several weeks, which caused them to enter a coma-like state for about an hour through each treatment. Nurses and doctors would then reverse the coma with an injection of glucose. This procedure would happen for 1 to 2 months, up to 66 days a week, meaning the patients were being put into daily comas for 30 to 60 days. Let's welcome to the stage today's main character, Dr. Manfred Sackle, an Australian neurophysiologist and psychiatrist. Born in 1900, he often found himself fascinated by the field of medicine as early as his teen years. So much so that in 1919, he began to study medicine at the University of Vienna, specializing in neurology and neuropsychiatry. If you guys didn't do the math there, at 19, good for him, okay? He spent most of his younger years studying and researching brain functions throughout Europe and soon immigrated to the US. Sackle earned his medical license in Vienna in 1927 and earned a research position at a psychiatric clinic in Berlin, where he began his research in neurosis. Now, in a way, Dr. Sackle kind of stumbled into the idea of insulin coma therapy, okay? So just bear with me here, okay? Since Dr. Sackle worked at a psychiatric clinic, he was introduced to a number of patients with different disorders. These disorders included, of course, schizophrenia, depression, and even drug addicts. One day in 1925, he had a patient walk in on a morphine overdose. Sackle had to think quick, and his first thought was, of course, to level it out. He took some insulin and injected it into the patient's bloodstream, sending him into an accidental coma. He accidentally put a little bit too much in there. Honestly, I cannot imagine what was going on through his brain. Oh my god, what am I gonna do? On the bright side, though, the patient soon woke up, and not just woke up, but he awoke with enriched mental clarity and very minute withdrawal symptoms. Not only that, but the patient claimed that his cravings for morphine were non-existent afterwards. Gotta love that, honestly. Sackel was shocked, to say the least, by his accidental findings, that so much so that he soon coined the method Sackel technique and theorized that insulin antagonized the neural effects of the products of the adrenal cortex, which, quote, will reinforce the nerve cell to conserve functional energy and store it to be available for the reinforcement of the cell, unquote. Now, before I go much further, I do want to quickly go over what exactly insulin is, what it's used for, what it does, etc. Insulin is a hormone that helps the body use glucose for energy and keeps blood sugar levels in check by lowering blood glucose levels. Insulin is typically prescribed to individuals with either type 1 or type 2 diabetes, but from my understanding, it is most commonly used by individuals with type 1 diabetes, which, if you're a diehard Joe Bro fan, you associate type 1 diabetes with Nick Jonas, okay? I know you girlies are out there. Now, insulin helps to lower blood sugar. If the individual accidentally has too much insulin in their body, the person will develop hypoglycemia, a fancy medical term for extremely low blood sugar. When a person experiences hypoglycemia, they may start to feel hungry, they may become shaky, sweaty, confused, and in some severe cases, the person can lose consciousness. That unconscious state is the very fine point that Sackel was aiming for. See, when someone reaches a state of hypoglycemia, if untreated, it can lead to some very serious complications, including seizures, brain damage, cardiac arrest, deep state comas, and even death. So, in a way, Sackel was playing on the verge of death. Sackel figured that if it worked on a drug addiction patient, this method could work on patients with other mental disorders. In order to perfect his technique, Sackel first experimented with animals in his own home to ensure that once the patient reached a hypoglycemic state, the hypoglycemia could be reversed safely in the event that it could. This would then allow for deeper insulin-induced comas to be administered without any harm. In 1930, his findings were officially published under the title New Treatment of Morphine Addiction. In 1933, Dr. Sackel's procedure was still looked at with some criticism by fellow neurologists, but he successfully persuaded them of its success. Patients were soon undergoing 5 to 6 insulin-induced comas per week for up to a total of 60 comas, or until the patient reached what Sackel considered a normal psychiatric response. Okay, so the technique in itself is a bit more complicated than the brief description I mentioned in the beginning, otherwise this episode would be over by now. Insulin coma therapy was a lot more complicated than it was let out to be. It was considered labor-intensive given that the hospital staff was quite literally playing on the verge of death with these patients. Patients with mental disorders, particularly schizophrenia, mind you, were selected on the basis of having a good prognosis and physical strength to withstand such treatment. So this wasn't available to just anybody with a mental disorder. So from the very beginning, the hospital staff knew that this treatment wasn't for just anybody. The daily insulin dose was gradually increased to 100 to 150 units, and on some occasions, doses of up to 450 units. This is insane, okay? 450 units of insulin were used in one session on a single patient until a coma was produced, at which point the dose would be leveled out to, try to avoid death. So let's do some quick Google math here, okay? Typically, it's recommended that a diabetic individual who is beginning insulin treatment is prescribed 0.2 units for every 2.2 pounds of the individual's weight. So let's take me, for example, okay? I am a solid 130. Divide that by 2.2, we get 59.1 rounded to 59. Then we multiply that by 0.2 and we get about 11.8 units. Now, just imagine, I'm a 5'1" woman, 130 pounds, Recommended insulin starting at 11.8, receiving well over 100 units? Are you fucking kidding me? That sounds pretty dangerous to me, if you ask me. Let's bring our attention back to Dr. Sackle. After about 50 to 60 comas or less, if the psychiatrist believed the maximum benefit had been achieved, the dose of the insulin was rapidly reduced before the treatment stopped. So think of it kind of like a roller coaster, I guess. It starts off pretty slow towards the beginning, quickly gains momentum as it reaches the top, and then once it reaches its maximum height, it quickly drops before it comes to a stop at the bottom. After each insulin session, patients would experience various symptoms of decreased blood sugar, including flushing, going pale, perspiration, salivation, restlessness, and if the dose was high enough, coma. Each coma lasted up to an hour. More often than not, seizures occurred before or during the coma as well. During the seizures, the hospital staff would just stand there and watch as the patient was tossing and rolling around, audibly moaning, twitching, and spasming on the floor. All to the point where some patients ended up with broken bones after each session. The interesting but also not surprising thing, given the context of the situation, is that some psychiatrists regarded these seizures as therapeutic, kind of like a rite of passage to get to the coma that rewired your brain. Does that make sense? But anyways, once the patients had reached the coma state, they were brought back to reality by glucose IVs. Now, I know what we're all thinking, okay? And it's that this all sounds like fucking torture. And you'd be right, because it was fucking torture. But remember, these patients only had to go through this insulin treatment 5 to 6 days a week. On the days that they weren't receiving insulin coma therapy, patients were kept together in a separate room that was eventually called the insulin unit, separate group from the other patients who weren't receiving this specific treatment. These groups were given extra special attention, treatment, and care. In fact, nurses were instructed to take their insulin patients out walking and to occupy them with friendly games, gardening, map reading, etc. And yeah, that's nice, but these patients had to be under careful supervision at all times anyways, because they couldn't survive without it. They were practically in danger 24/7 of hypoglycemic aftershocks after each coma, which can be fatal. Although Dr. Sackle began his practice in 1933 Vienna, fellow psychiatrists and neurologists noted his work and decided to take a crack at it. In 1935, Dr. Joseph Wartis officially introduced insulin coma therapy to the U.S. By 1940, most U.S. psychiatric hospitals offered ICT treatments. First-hand experience testimonies are rare to come by, mostly because one of its side effects was loss of memory. However, those few who could remember an episode or two would often recount just the most horrendous moments. An anonymous patient from Trenton, New Jersey once recounted, "The sickness, the taste of blood in my mouth, the foggy pain in my head. Very little of it is clear in retrospect, to save the agony of emerging from shock every day." Now, I think I say this almost every episode, but it is important to remember that at the time there was little to no information on how to properly care for patients with mental disorders. Insulin coma therapy was seen as a breakthrough treatment given its priorities. So, of course, at first it was seen with very kind eyes. According to Sackle and a few fellow psychiatrists, insulin coma therapy had a claimed success of over 80% in treating schizophrenia. However, a few others argue that it merely accelerated remission in patients who would undergo remission anyways. Do y'all get what I'm saying? Awesome. Although, according to Sackle's official report, 70% of patients had a full remission and 18% had a social remission, a total of 68% of patients were normal enough to be discharged. Reports are one thing, but the reality is far from it. If anything, the procedures proved to have caused more damage than good in the end. Some early theories regarding its method were that it worked because it induced brain damage in areas that were inactive to begin with. In other words, patients were somehow jolted out of their mental illness. Again, this is the early to the mid 1900s, okay? The hypoglycemia that resulted from the insulin coma therapy made patients extremely restless, sweaty, and liable to further convulsions or aftershocks, which is why they were in such constant aftercare. Furthermore, patients whose treatments were prolonged emerged from their treatment, quote, grossly obese due to what is called glucose rescue-induced glycogen storage disease. However, the most severe and long-term risks of ICT were death and permanent brain damage. Again, similar to the seizure logic. Some psychiatrists viewed the permanent brain damage as therapeutic improvement because they showed loss of tension and hostility. Like, okay, like I get that this was the mid 1900s and science was still developing in the field of psychiatry, but surely someone had to see how wrong that logic was from the beginning. By the 1950s, almost every psychiatric hospital in the US and UK had an insulin unit. By 1953, a British psychiatrist by the name Harold Bourne published a paper titled The Insulin Myth, where he argued that there was no sound basis for believing that ICT counteracted the schizophrenic process, like at all. He claimed that any improvement the patients saw was due to the immaculate care they received while in treatment by the hospital staff. Like, that's really all they needed all along, some careful and caring attention. Yet, despite these drawbacks, ICT continued as a landmark psychiatric process for over a decade longer. I'm talking as late as like 1969, which, you guys, I mean, that's really not that long ago. For us millennials, most of our parents were born before that. As my mama always says, nothing lasts forever and everything must eventually come to an end. After multiple studies showing that the therapy had no real medical value, by 1970, ICT had mostly fallen out of use in the US. In other parts of the world, like China and the USSR at the time, it continued well into the late 1970s. A lot of its downfall didn't rely so much on the damage it was causing, but more on its inconvenience. By 1970, many psychiatric hospitals had switched from insulin coma therapy to electroshock therapy, a procedure with its own issues that we'll be covering here soon. Despite its proven lack of success, Sackel defended ICT until his death at 57 from a heart attack. Which, listen, I get it, okay? This was his baby, okay? And yes, he did contribute a lot to the field of psychiatry, although his logic was extremely off, okay? But his contribution to psychiatry remains historically significant despite the fact that ICT is no longer in use for some very valid reasons. Have you guys ever read or watched A Beautiful Mind starring Russell Crowe? It's based off the true story of a man named John Nash, a famous mathematician who suffered from schizophrenia and was receiving insulin coma therapy as treatment. So like, I've read the book and I've watched the movie, both so impacting and so sad, but honestly I think the story does an amazing job at highlighting what it's like for someone who's living with schizophrenia and also what it was like to have to be subjected to this treatment. I won't spoil it for anybody in case you haven't seen the movie or read the book, but if you do, just be ready to shed multiple tears, okay? Well, my curious cats, thank you so much for tuning in to today's episode. I hope you learned a thing or two. Honestly, it's a topic that whenever I bring it up in conversation, a lot of people have surprisingly never heard of it. If you enjoyed today's episode, please remember to like, follow, and subscribe on YouTube, Spotify, and Apple Podcasts. Also, follow the podcast on Instagram at the Say Psychology Podcast to, get the 411 on news on episodes and updates. Please leave any thoughts or suggestions for future episodes down in the comments because I want to know what y'all want to know. As always, citations will be in the description if you want to check those out. Stay blessed, stay sane, stay psyched. I love you. Bye.